At the first diagnosis, pregnancy marks a transformative journey for women, involving significant physical, emotional, and lifestyle changes vital for maternal and fetal health. Though not a disease, pregnancy parallels natural life cycle stages like menopause, yet it can worsen pre-existing conditions and cause discomfort or dis-ease. Common changes during pregnancy include physical changes such as breast tenderness, morning sickness and weight gain, and hormonal fluctuations. It's an emotional roller coaster with feelings of excitement, joy, anxiety, and fear due to hormonal shifts. Diet and nutritional changes are often necessary for health of mother and baby. Alcohol and tobacco abstinence or decreased consumption is strongly encouraged. Medications may need to be reevaluated for potential risks or harm to the baby. Exercise is generally encouraged, but safety and comfort must be considered. Pregnancy can impact work, requiring maternity leave and postpartum adjustments. Fatigue and the need for more rest are common, leading to changes in sleep patterns. Regular prenatal checkups are crucial for monitoring the health of both mother and baby. Emotional well-being and support are essential and can be more challenging during pregnancy. Social life and relationships may be affected by lifestyle adjustments. Financial planning and budget adjustments are often necessary to prepare for the baby. Safety precautions become a priority during pregnancy. Long-term goals and plans may be reassessed as parenthood approaches. Each woman's experience is unique, and some may find these adjustments more challenging than others. It's vital to offer non-judgmental support from healthcare providers, family, and friends during this transformative journey. Pregnancy is a life-altering event that leads to the birth of a new life and a new chapter for women. Choosing pregnancy and birth assistance is a significant decision. Patients expect a combination of clinical expertise, emotional support, advocacy, and respectful care to ensure a safe and positive birthing experience. For healthcare professionals, providing such care is essential for a safe and positive birthing experience, all while adhering to existing hospital policies, procedures, and state federal laws. However, what if a pregnant woman discloses her cannabis use during her pregnancy, regardless of its legality in her state? This presents complex ethical and medical considerations that healthcare providers must address with care and sensitivity. Hello, everyone. My name is Jodi Chapin, and I've been supporting and empowering women during the childbirth process as a registered labor and delivery nurse for the past 35 years. I'm also a certified level 3 Reiki practitioner. Beyond my expertise as a nurse, I'm also a medical marijuana patient, drawing from my own history of suffering. I have integrated cannabis into my healthy lifestyle, adopting harm-reducing consumption methods. Through this journey, I have successfully transitioned away from pharmaceutical medications that had previously caused me severe side effects, even leading to hospitalizations. I'm not only a devoted healthcare professional and patient, but also a nurturing wife and mother of 3 beautiful children. Over the years, I've maintained an open dialogue with my children about my cannabis use, adapting my approach as my understanding of the plant deepened. When I'm not tending to expectant mothers at the hospital, I'm an active participant as a cannabis nurse consultant with the nonprofit Green Network Providers, serving the community as a vital bridge between patients and experts within the medical cannabis realm, with a mission revolving around dispelling the stigma linked to alternative plant medicine, particularly cannabis. Dr. Melanie Dreyer embarked on her research journey into cannabis during the summer of 1970 while pursuing her doctoral studies in anthropology at Columbia University. Her initial assignment was to investigate the impact of cannabis on the productivity of agricultural laborers in Jamaica. She became interested in Jamaican women who were using cannabis for all kinds of ailments. This included relief of symptoms around pregnancy, childbirth, and breastfeeding. With the support from the National Institutes of Health, Dr. Dreyer published her findings related to cannabis use during pregnancy. The Jamaican women studied were part of a cultural tradition of using cannabis as medicine. They knew how to prepare it with tea, milk, and spices. It was used to cure and also prevent illness. Consuming cannabis during pregnancy was a way to relieve nausea, increase appetite, and provide rest and relaxation. In this first study conducted in 1988, the Jamaican women were good subjects, for they didn't use other substances like alcohol, tobacco, cocaine, or other medications. The study found no significant differences in physical exam data, birth weight, length, or gestational age between the two groups. However, some differences in neonatal behavior, particularly at 30 days of age, are observed. Babies of cannabis-using mothers showed more positive recovery curves in terms of sleep-wake states and autonomic stability, indicating better organization and alertness. The study concludes by suggesting that environmental factors in the caregiving environment may play a more significant role in neonatal outcomes than the sole effects of cannabis use during pregnancy. It also highlights the need for further research in this area. However, when looking at the results of the 5-year follow-up study with Dr. Dreyer, which followed the development of these 59 Jamaican children from birth to age 5, they were significantly related to certain aspects of the home environment and how regularly the children attended preschool. The study did not find strong evidence that prenatal marijuana exposure had a negative impact on children's development, but it did suggest that factors like the home environment and preschool attendance played a significant role in the outcomes. Pregnant individuals increasingly turn to cannabis for symptom relief. Yet many healthcare providers feel unprepared to discuss its use, prompting patients to seek information from alternative sources. Patients desire non-judgmental conversations with healthcare providers about prenatal cannabis use, seeking balanced, evidence-based information. Black participants in particular expressed concerns about potential repercussions, reflecting mistrust of the healthcare system. Patients appreciate clinicians who respect their choices and offer alternatives to cannabis use, emphasizing the importance of comprehensive, objective information delivery. Another study investigated risk perception concerning cannabis use during pregnancy among 21 participants, including 57% African American, 38% white, and 5% multiracial individuals. Results showed that 1/3 of participants used cannabis during pregnancy, with 24% using alcohol and 48% using tobacco. Factors influencing their perceptions include relief from pregnancy-related symptoms, healthcare providers' endorsements of cannabis safety, anecdotal stories from acquaintances, fear associated with prescriptions and medications, and a preference for natural remedies. A prevailing theme was a general distrust of healthcare providers, highlighting the importance of fostering trust between patients and healthcare providers in addressing cannabis use during pregnancy. Another study examined maternal health providers' perceptions of cannabis use during pregnancy in Southern California, including midwives, OBGYN physicians, and OBGYN residents. Findings revealed a lack of formal training on the topic, resulting in a reliance on self-education. Providers tended to take a case-by-case approach due to the absence of clear clinical guidelines, leading to variations in counseling approaches influenced by personal views and biases. Providers often avoided discussing cannabis with pregnant patients to preserve the patient-provider relationship, prioritizing trust and rapport. The study underscores the challenges faced by maternal health providers and emphasizes the need for comprehensive training, clear guidelines, and harm reduction strategies to better support pregnant individuals. A 19-year-old first-time mother grappling with severe mental health issues, including bipolar disorder and borderline personality disorder with schizophrenic tendencies, faced complications during her initial pregnancy despite adhering to medical advice and lifestyle modifications. Having abstained from medications for years prior, she had turned to cannabis for self-treatment. Her first child was born prematurely, with both experiencing health complications. During her second pregnancy at 26, she confronted similar mental health challenges, but opted for cannabis use in the third trimester, leading to involvement from Child Protective Services. At 35, she elected to use cannabis from the second trimester in her third pregnancy, encountering similar hurdles with drug testing and CPS intervention, though the case eventually closed. Despite obstacles, her children have flourished, surpassing various health learning obstacles with promising future ahead. As of September 2021, American College of Obstetricians offered a distinct set of guidelines and recommendations concerning cannabis use during pregnancy and lactation. ACOG strongly discourages cannabis use during pregnancy. They also advise against cannabis use while breastfeeding. ACOG emphasizes the importance of healthcare providers engaging in open and non-judgmental discussions with pregnant and breastfeeding individuals regarding these risks. On the other hand, National Council of State Boards of Nursing, as a nursing regulatory body, did not establish its guidelines on this matter. Instead, they expected nurses to adhere to the standards and recommendations established by authoritative medical organizations like ACOG when delivering care to pregnant and breastfeeding individuals. And now, as of September of last year, with the American Nurses Association officially recognizing cannabis nursing as a specialty, and hot off the press with the DEA with this rescheduling, how will this affect how we guide women in the future on safety of use and benefits versus risk? Labor and delivery nurses act as a source of information, comfort, and guidance, addressing the diverse range of emotions with compassion, honesty, and a focus on the newborn's well-being. Their responsibilities include prenatal education, monitoring of vital signs and contractions during labor, assisting with pain management, offering physical and emotional support, aiding in childbirth, providing neonatal care, managing complications, maintaining meticulous documentation, collaborating with other healthcare professionals, offering emotional support to families, ensuring postpartum care, advocating for patient preferences, all while staying updated on the latest medical practices. This patient's journey highlights the transformative power of compassion and non-judgment in nursing. From Maine, where medical cannabis has been legal since 1999, she chose a home birth supported by a caring midwifery team, embracing cannabis's healing potential. Her exploration of cannabis in her 20s offered relief from ADHD and fibroid pain, leading her to pursue a gentle cannabis consumption during her pregnancy to alleviate symptoms. While refraining from cannabis during labor, she found solace in its use postpartum, nurturing her newborns and embracing natural parenting. This one woman's story shines as a beacon of compassion and non-judgment in nursing. It reminds us that as healthcare professionals, our role is to support and understand our patients, even when their paths to healing may differ from our own. In doing so, we can inspire hope, foster empathy, and truly make a difference in the lives of those we care for. Thank you, everyone.